right, good morning. I'm going to do an oral care, so always check the patient's chart, wash my hands before I enter the room, introduce myself, and always check the patient's ID band. Always, before you begin, apply the appropriate PPE. So you're going to make sure you have gloves on, a mask, anything like that, so that way you protect yourself from the patient. And then also, so what you're going to do is go ahead and auscultate the lungs, listen before you begin. Make sure everything sounds good. Always check the patient's mouth to see if there's any sores developing, anything like that needs to be taken care of. And then next thing you would do is go ahead and set up everything to do your suctioning. So you're gonna have this canister here that's gonna catch all your secretions. So you're gonna plug that into your suction, and then you're gonna turn that on to -100 and -120 when you do your suctioning. So always before you begin, always check the placement of your ET tube, endotracheal tube here, so that way you know kind of where it is before you start doing all your suctioning. So you always want to do oral care every 2 hours when the patient has an endotracheal tube in. You also may have to do it if a patient may have like BiPAP mask on or something like that. You may have to make sure everything looks good there. So what you're going to do is get your anchor catheter, anchor and your suction handle here. And what you're gonna do is you're gonna connect it to your suction, and you're gonna have an extra tubing here so that way you can reach the patient. So you're gonna place it on there. Then you'll turn on your suction handle, and you're gonna just double check to make sure everything is suctioning properly before you place this into the patient's mouth. So when you're ready, so you turn it back off, and then you take your cover down to make sure that's done. And then you would go ahead and suction the side of the mouth before you clean it. And then you would suction the back of the mouth. Try not to hit any of the gag reflexes or anything like that when you're suctioning. So then when you're done, then you cover it back up. Make sure it's turned off. Remove this and place it in a safe area, because this can be used again to help suction out the patient's mouth. So the next thing you're going to do is a suction swab. So this one, you're going to take out your suction one. You're going to take out your suction swab. Then you're going to get your solution ready. Make sure everything is ready. And you're going to place it onto your suction handle here. You don't have to have your suction handle turned on right away. So you're going to go ahead and put it into your oral cleaner here, and what you're going to do is you're going to clean the sides of the mouth, inside the cheeks, around the gums. Make sure you clean the tongue and the roof of the mouth. And so if you see any excess, so this one has a hole, and so this one you can go ahead and turn on to suction, and you can suction any of that out. So if you see anything after you've done this, you can go ahead and take your anchor and suction any excess out. And then the next one you're going to do is take your moisturizer. So you're going to have your applicator swab, and you're going to take this and you're going to put it onto your applicator swab, and you're going to have like kind of like a toothbrush, and then you're going to take this and you're going to spread it around so that way it spreads evenly and while you're cleaning the mouth. So you're going to go and get it inside of the cheeks and everything, make sure everything is nice and moisturized, tongue, and you're also going to moisturize the lips to make sure they're not dry, because they can get pretty dry with being on your oxygen that way. So when you're done, you dispose of that, and then you come back after 2 hours, and then you do your toothbrush care. So you get your Typlax solution, and you grab out your toothbrush for the patient, and then you're going to take your suction and you're going to place it on there, and then you're going to dip it in there, and you're going to go ahead, you don't have to turn it on, you're just going to take this toothbrush and you're going to do circular motions around their teeth. Make sure you get on the backs of their teeth and everything, so that way you don't have any buildup while they're in your care. So you're going to go ahead and take your toothbrush and dispose of that, and then you'll set this in your safe area, and then you're going to go ahead and get your applicator swab, and then you're going to go ahead and get your moisturizer again. You're going to place it on your applicator swab, spread it around. Then you're going to moisturize the inside of the cheeks, the lips, anywhere where the mouth may get dry or anything like that, so that way you don't prevent any sores from their mouth being, with them being on oxygen. So you're going to dispose of that. So then again, you suction out anything excess in their mouth if you see anything. Then you'll come back after 2 hours, and then you're gonna go ahead and take your suction catheter. So next one is your suction catheter. And so this one you're gonna place on your suction, and you're just gonna place it like that. So you're still gonna try to make sure you stay nice and clean with especially suctioning the patient's mouth. Not touching the patient's bed, make sure it doesn't touch anything like that. So when you're ready, you turn it on, make sure you hear it, make sure it sounds okay, and make sure it's working. So you're gonna go ahead and suction the patient out, make sure there's no excess secretions around the endotracheal tube, and then you're gonna go ahead and go towards the back and make sure you kind of get any secretions that may be sitting above the balloon, the cuff in there. And so then when you're done, you would dispose of this, and then you'd set this in an appropriate area. So this is disposed of. So after you're all done, make sure everything you have has been disposed of. Always, if a patient is being sectioned, they can have like a protection cover on them, so that way nothing splashes on it, so that you would dispose. Then you're ready, and then you check the patient's endotracheal placement. So then you make sure it's at the appropriate number, and make sure the cuff is inflated properly. And then you listen to the patient's lungs. Always get the post-vital signs. Remove any PPE, wash your hands, and then go chart on the patient's chart what you did for them.